Good morning and welcome back. Before I say another word, I need you to stop what you are doing and listen, because what I'm about to share with you could change what happens tonight while you sleep. A close friend of mine, a retired civil engineer named Raymond Kowalski, 73 years old from Akron, Ohio, went to bed on a Tuesday evening, feeling perfectly well. His wife said he had laughed at the news. He had a small bowl of ice cream. He kissed her goodnight. By 4 a.m, he was gone. Cardiac arrest, completely silent, while she slept 3 feet away. No chest pain, no racing heart, no warning of any kind. He was gone before the paramedics reached the end of their street. I think about Raymond constantly, because a study published in the European Heart Journal, tracking more than 92,000 adults over 12 years, found that the hours between 10 at night and 6 in the morning carry a cardiovascular risk profile that most people, and most doctors, never seriously discuss. The pre-dawn hours are when blood pressure surges, when clotting factors spike, when the heart is most vulnerable to the kind of catastrophic event that takes someone like Raymond while his wife is still dreaming. And the research is absolutely clear. Specific nightly behaviours either protect against that window of danger, or they quietly, invisibly make it worse. Today, I'm going to walk you through 6 of the most common and most overlooked nighttime habits that are silently raising cardiovascular risk in adults over 60. Ranked from number 6 down to number 1, and I want you to know, the closer we get to number 1, the more critical it becomes. Number 2 shocked even me when I reviewed the data, and number 1, I believe, is the piece that ties everything else together, including what happened to Raymond. Before we begin, I want to ask you something personal. Leave a comment right now and tell me your age and whether you have ever woken up in the middle of the night with your heart pounding or a sudden feeling that something is wrong. That comment matters to me, and it may matter to someone else reading along who has never said it out loud. Coming in at number 6 is something most of my patients do every single night without a second thought. Eating within 2 hours of sleep. Most people think of this as a weight issue, a metabolism concern, maybe something that causes indigestion, but what is actually happening inside the body is far more serious than that. When you eat close to bedtime, particularly anything high in sodium, saturated fat, or refined carbohydrates, your blood pressure does not wind down the way it should when you lie flat. Normally, the body enters what we call a nocturnal dip, a natural reduction in blood pressure of 10 to 20% that allows the cardiovascular system to rest and repair. A study from the American Journal of Hypertension, following over 4,000 participants, found that late-night eating eliminated this protective dip in a significant portion of subjects. Non-dippers, that is the clinical term, have a measurably higher risk of stroke and cardiac events. A 41% higher risk compared to those whose blood pressure falls as it should. That is not a marginal finding. That is the difference between a heart that repairs itself through the night and one that keeps working at a pace it was never meant to sustain. My recommendation: finish your last real meal at least 2.5 hours before you plan to sleep. If you need something after that, a small handful of walnuts, the alpha-linolenic acid, genuinely supports vascular function, will not trigger the same hormonal and pressure response. At number 5, we have something so normal it almost never gets questioned: sleeping in a room that is too warm. I know that sounds almost too simple to be serious, but here is what is actually happening inside your body when the ambient temperature stays above 68 or 69 degrees Fahrenheit through the night. Core body temperature is supposed to drop naturally as you move into deep sleep. That drop is not incidental. It is the signal your cardiovascular system uses to slow the heart rate, lower blood pressure, and initiate the cellular repair processes that protect arterial walls. Research published by the National Institutes of Health found that elevated sleeping temperatures directly impair deep sleep architecture in adults over 60. And without adequate deep sleep, inflammatory markers, C-reactive protein, interleukin-6, rise measurably. These are not abstract chemistry terms. These are the compounds that accelerate plaque formation in arteries. The same compounds found elevated in patients in the weeks before a cardiac event. I see this connection in my patients every single week, and most of them have never heard it. Set your bedroom between 65 and 68 degrees tonight. That is the evidence-supported range. If you run cold, add a blanket, but let the room stay cool. Now we are moving into more critical territory. Number 4 is alcohol, specifically the belief that a small drink before bed helps you sleep. This one breaks my heart because the patients who do this are often people who genuinely struggle with sleep, who are not drinking recklessly, who have simply been told by culture or by habit that a glass of wine helps them wind down. And it does help them fall asleep. That part is real. But here is what is actually happening after they close their eyes. Alcohol metabolizes into a compound called acetaldehyde, which fragments sleep architecture in the second half of the night. REM sleep collapses. The heart rate variability, the flexibility of the heart's rhythm that indicates genuine cardiovascular resilience, drops sharply. A landmark study from the University of California tracked sleep physiology in adults after moderate alcohol consumption and found a 24% reduction in heart rate variability on drinking nights. Heart rate variability is not a number most people know to track, but in cardiology, it is one of the strongest predictors of long-term cardiac health we have. A suppressed HRV through the night means the heart is locked in a state of low-level stress for hours. Compounded over months and years, that is not harmless. Stay with me here, because what I'm going to share at number 3 connects directly to this. The two habits work together in a way that multiplies the risk. Number 3 is one that surprises nearly everyone I mention it to: going to bed dehydrated. And I do not mean dramatically dehydrated. I mean the mild, chronic, completely unnoticed dehydration that affects the majority of adults over 60. Here is the physiology. As we age, the thirst mechanism becomes less reliable. The body's ability to conserve water overnight diminishes. And when blood volume drops even slightly, the blood thickens, quite literally, the way honey thickens compared to water, and the heart has to work harder to push it through vessels that may already be narrowed by years of arterial change. A study in the Journal of the American College of Cardiology found that even mild dehydration at bedtime elevated fibrinogen levels, a clotting protein, significantly. In the pre-dawn hours when cardiovascular events are already statistically most likely, thickened blood moving through constricted arteries is precisely the combination that produces the kind of outcome that happened to Raymond. This is why I tell every single patient over 60, drink a full glass of water, not juice, not coffee, water, with a small amount of magnesium and potassium, specifically 2 hours before you sleep. Not 1 hour, 2 hours, so you are not waking up through the night. The electrolyte balance matters. Plain water without those minerals can actually dilute sodium and disrupt cardiac conduction if taken in too high a quantity. Specificity here is not optional. And now we have arrived at number 2, the one that stopped me cold when I first reviewed the research, and the one that I believe is the most underestimated cardiovascular risk factor in nightly life for adults over 60. Sleeping on your back with your airway partially obstructed. In other words, mild, undiagnosed sleep apnea and positional airway compromise. This is not about people who snore dramatically and wake their partners. This is about the millions of older adults who have subtle, partial airway obstruction that produces no noise, no obvious gasping, no dramatic symptoms, just brief, repeated microarousals through the night that the person is completely unaware of. During each apneic event, oxygen saturation drops. The sympathetic nervous system fires an emergency response. Cortisol spikes, adrenaline releases, blood pressure surges. This happens dozens of times per night in people who have absolutely no idea it is occurring. A study from the Journal of the American Medical Association tracked adults over 65 with undiagnosed mild sleep apnea and found a 67% higher rate of cardiovascular events over a 5-year follow-up period compared to matched controls with normal airway function. 67%. That is not a marginal risk. That is the difference between waking up and not waking up at all. The recommendation I make to every patient who has any suspicion, a partner who has noticed any irregular breathing, any unexplained fatigue, any morning headache, any history of waking suddenly with the heart pounding, is to ask their physician for a home sleep study referral. This is not an invasive test. It can be done in your own bed. And if positional obstruction is found, even a simple wedge pillow elevating the upper body between 7 and 15 degrees can reduce apneic events significantly before any device intervention is needed. Now, we have reached number 1, and I need to bring Raymond back because this is the entry that explains his story, and possibly yours. The number 1 most dangerous nighttime habit for adults over 60 is chronic sleep fragmentation, combined with emotional suppression before bed. I am going to explain exactly what I mean. Most people believe the body needs a certain number of hours of sleep. That is true. But what the research now shows, overwhelmingly, including a Harvard Medical School study tracking over 70,000 adults for 8 years, is that the continuity of sleep matters as much as the duration. Fragmented sleep, sleep interrupted by worry, by unresolved stress, by the emotional residue of whatever the day contained, produces a chronic elevation in cortisol that does not reset properly overnight. And cortisol, in sustained nighttime elevation, directly promotes arterial inflammation, accelerates plaque instability, and drives the kind of sudden plaque rupture that produces a fatal cardiac event in someone who, by every external measure, seemed perfectly fine. Raymond had been carrying something quietly for months before that Tuesday night. His wife told me this later. He had been worried about money, about his son, about the diagnosis his brother had received. He had not talked about any of it. He went to bed with all of it held inside, every single night, and his body responded the way bodies do, with a cortisol profile that kept his cardiovascular system in a state of silent, low-grade emergency night after night, until the night it could not sustain it. The intervention I recommend, and the research supports this specifically, is a 10 to 15 minute structured decompression before bed. Not television, not scrolling. Write down, physically write down, the 3 things weighing on you most heavily, followed by 1 concrete step you will take on each tomorrow. This process, what researchers at the University of Baylor call the offloading protocol, measurably reduces pre-sleep cortisol. It signals the brain that the threat has been acknowledged and delegated to tomorrow. The body stops waiting for an emergency that never comes. The heart rate falls. The vessels relax. The repair window opens. That is what Raymond never had. That is what you have, right now, tonight. If this information reached you before it reached someone you love, please share it. We are a community of people who believe that aging powerfully is absolutely possible, that the body, given the right conditions tonight, will do everything in its power to carry you forward. Subscribe if you have not already, because next week I'm going to walk you through the 5 morning habits that compound everything we discussed today, for better or for worse. Leave me a comment right now. Which of these 6 habits surprised you most? And are you going to make a change tonight? Raymond could not act on this. You still can. Do not wait until you have a reason to wish you had started sooner. Start tonight.